How far away are we from developing another test for prostate cancer diagnosis?
I would have to say that the answer is we're not far away from developing more and more tests for diagnosis, but what we probably are in very serious need of is to understand how effective those tests are. And I think that's really the critical distinction. So yes, we're developing additional tests, but really the proof is going to be in the pudding as to how important those tests are, how relevant those tests are. And I think that will play out within the next 5 years or so, because prostate cancer is a quite slow growing tumor, thankfully. That means that the tests take longer to get the right kind of validation.
So when we're testing for prostate cancer, I'm looking for a diagnostic test. There's lots of different ways that we can do it. We can try and look for a blood test, we can try and look for a urine test, and actually there's been huge advances in the last 5 years of finding potential new markers that we can detect in those different fluids to try and diagnose prostate cancer better. I think the key thing to remember is that although we say PSA isn't very good, actually it's not that bad. And what we need to do is combine new markers with PSA to actually make it a better test. And actually with the huge advances we've had, we've got some really good markers going forward that are likely to make a huge difference. And probably within the next 5 to 10 years, I think we'll see something coming through that will be an improvement on the PSA test. In terms of a urine marker, it's slightly more difficult because we all know that when you have a wee, that actually your urine can be different strengths, and that adds a little bit of more complication to that. But I think it's very much on the cards, so within maybe 10 years.